Good evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently just a few minutes after 7. My apologies. I'm running a little bit late today on Tuesday, the 26th of May. I want to do today's daily recap of events that affect the way you get, protect, and enjoy your money, your life, and your retirement. The question for today is, what workers are at increased risk? And I'll get to that in just a few minutes. Right now, as we start every day, at least for the last month or so, since I started doing these things, I want to touch base on the current number of cases. Right now, the current confirmed cases in the U.S. is 1,676,000 cases right now. That's a bit of a jump. Again, we've had a 3-day weekend. The deaths right now are at 98,787. We're just shy, okay, of 100,000 deaths. And chances are we're going to see those before the end of the week. It's sort of depressing, but that's what we have right now. There's still a number of cases that have recovered. However, the cases being counted as recovered are not really all that accurate because of the way different states are counting recovered, or they're not counting them at all. They're just ignoring them. They're busy with other things at this point in time. New York State still has right now 363,000 cases. Okay, again, a big jump, and their deaths are at 29,000. Again, it's a 3-day weekend, so we've jumped up a bit since Friday. New Jersey's got the number 2 spot. Still with the second highest number of cases at 155,000 cases. And where are they at right now with possible deaths? I think they're at 11,194 deaths. And again, they're ticking up. Everybody's ticking up just a shade. The number 3 spot is Illinois. Okay, Massachusetts got the number 4 spot. California's at number 5. Pennsylvania's at number 6. Okay, Michigan's at number 7. And then we move down to 8, which is Texas. And then number 9 is Florida. And it rounds out at number 10 with Maryland. And again, it's easy to sit here and just run off about all these numbers. But each one of these numbers represents a person some way, shape, or form. And we don't want to forget about those things. For a while, I was giving you in-depth on a number of these people every day. There's just obviously at 98,000 people dead, I can't cover them all. There's just too much going on right now. Again, it's been a busy weekend, obviously. 3-day holiday weekend. Everybody got out a little bit, and it got sort of interesting. All 50 states have reopened in some way, shape, or form, some degree. Some more than others. Some like they never closed. And some of them actually never did close. There's still no treatment, and there's still no vaccine. Okay, which brings me to today's question. Okay, what workers are at increased risk? Now, I've been talking about this several times over the last few months or so, and right now at the holiday weekend just passed. The first season of barbecues behind us. I want to give you an update on what's going on and how it could be affecting you, okay? And, now and in the near future, the meat industry is trying to get back to normal. You know what happened. They're in small towns, and they're generally the main employer in a particular town, and they had a number of cases, and a number of plants would shut down. And we talked about this a number of different times. President came in and he didn't use the Defense Production Act to get tests or supplies, but to get cheeseburgers, he used the Defense Production Act and ordered meat packing plants to stay open. Well, the workers are coming up the short end of that deal. Right now, there are more than 11,000 cases tied directly to Tyson Foods, Smithfield Foods, and JBS. Okay, that's the third meat packer, basically. Now, as COVID spreads throughout Nebraska plants, okay, workers are really feeling helpless and afraid. Workers at Tyson meat processing plant in Lexington, Nebraska, are getting sick with COVID, and they say the company hasn't done enough to protect them. Now, Tyson knows it's under increased public scrutiny at this point in time and understands the public relation thing. Now, Tyson Foods, which is the largest meat processor in the U.S., has transformed its facilities across the country. Okay, since legions of its workers started getting sick from COVID. It has set up on-site medical clinics, screening for employees for fevers at the beginning of the shifts, required use of face coverings, installed plastic dividers between the stations, and has taken a host of other steps that slow the spread. Now, despite those efforts, a number of Tyson employees with coronavirus has still exploded from 1,600 a month ago to more than 7,000 today, according to public reports and public records. Now, what happened at Tyson and the meat industry overall shows how difficult it is to get the nation back to normal, something that's semi-normal, in what's considered essential fields as food processing right now. Okay, meat companies have spent hundreds of millions of dollars on measures such as protective gear, paid leave ventilation systems, that they forced plants to shut down, and these are still hot spots. Okay, and again, they're still a main industry in certain counties. Okay, so these people got nowhere to go. Now, each county has experienced a surge in cases, and some companies say they are limited in just how much they can keep up with the workers separated from one another. Okay, they can only do so much. It's a very labor-intensive type of situation. You may have seen at some point in time a car factory production line. You may have seen videos of that at some point in time. Line goes through, and each worker does a little piece of things. You may have seen the old Lucy skit on the chocolate factory, and she was supposed to wrap individual chocolates, and then they sped up the conveyor belt, and it got overwhelming. Well, these meat processors are in the same situation. They got a conveyor belt going through, and they've got carcasses on these belts, and each one grabs a carcass, and they do whatever, and then each does its own thing. So it's a high gear situation. It's very labor intensive. Now, only a portion of the labor force has gone back to work so far because they don't have enough people there. Okay, and right now, as the meat supply remains deeply strained, as the barbecue season gets underway, okay, a May report from CoBank, which specializes in serving rural America, warns that meat supplies in grocery stores could shrink as much as 35%, and prices could spike as much as 20%, and the impact could be even more acute later on this year as the knock-on effects from the agricultural supply are really felt. Now, grocery stores have been able to partially at least meet consumer demands thanks to the meat supply they already had in the chain in March before the pandemic broke out. But the report said the supplies are quickly getting used up. The prospects of long-term shortages giving rise to an intense debate about whether the industry should really reopen faster or whether safety should be prioritized as a concern. Now, with the April 28th executive order encouraging meat packing, it didn't encourage them, it actually ordered them to stay open. The Trump administration had said the food supply must be weighed equally with safety. And over the past month, okay, over half of the 30 meat processing plants that had shuttered because of the coronavirus have reopened. Now, early in May, Vice President Pence said our objective is two equal goals. Number one is the safety and health of the workforce in our meat processing plants. And number two is the strength of our food supply in getting people back to work. But others say that safety must be paramount concern and that the industry still has a long way to go before facilities are safe again. Now, what's clear is the industry's efforts so far, okay, though they have, lessened the virus spread to a lot of degrees, they haven't come anywhere close to stopping it. Now, over the past month, the number of infections tied to the three country's biggest meat processors, Tyson, okay, Smithfield Foods, and JBS, has gone from just over 3,000 to more than 11,000 cases so far, according to current media analysis. Now, throughout the industry, the deaths have tripled, surging from 17 to at least 63, according to a Midwest Center for Investigative Reporting, which is tracking the outbreaks throughout the local news. Now, you say, well, 63 isn't a lot. Well, if you think about that, how many people are employed where you work or used to work? Now imagine 63 of those people actually dying from COVID. Do you think it puts a damper on the entire operation? Just a little bit. Now, 4 of the plants that reopened saw outbreaks with more than 700 positive cases, according to the center. Tyson Food Operations in Logansport, Indiana, Perry, Iowa, and Waterloo, Iowa, and the Smithfield plant in Sioux Falls, South Dakota. Okay. The debate over reopening continues even with the safety concerns, and it really presents difficult choices. Okay. Meat plants are located in rural areas where they're among the largest employers. Okay. It could be the main employer in a particular town. And when infection rates in communities within 15 miles of a meat plant are twice the national average, it gets you wondering, don't it? You think? You don't have to wonder very much what's going on. They're all tied to the plant because of the working conditions in the plant. These people are on top of one another. They can't help it just because of the way the plants are set up, just because of the nature of the business. Now, the recent closures have cascaded throughout local economies as farmers who, supply the plants with, are left with their animals. Okay. The plant has a certain current capacity. Right now, they are backlogged at 170,000 hogs a day. 170,000 hogs a day can't get processed because the plants can't handle them. Now, these hogs will eventually stay on the farms too long to be, and end up growing too much to be accepted in the harvest facilities. It's estimated that up to 10 million market hogs will need to be euthanized. Now, this has an effect all the way down the line, obviously. Okay. The grocery stores can't get the meat from the plants. The plants can't get the meat in because they've got sick workers or a lack of workers because so many of them are sick or dying. Okay. The farmers who would supply the plants can't get the hogs, cattle, or chickens to the plants because they can't take them anymore. They don't have the people to process them, which means now the farmers are stuck with all this livestock inventory. They have to feed them. They're going to cut down the feed, okay, which means now they're not buying as much feed from the people who are selling the feed. Okay, and it's just down the line. It's a big operation, and it affects a lot of people, not just consumers on the back end where we are, okay, that we can't go in the store and get our chicken and burgers. Okay. Companies have tried to get back to normal operations, and local union officials wonder, whether they're really ready or not. Tyson's biggest pork plant in Waterloo opened on May 7th, and they had new, safety precautions about social distancing. The plant reopened the same day, and officials in Blackhawk County, where it is located, reported more than 1,000 employees out of the 2,700 there had tested positive for COVID. Now, just imagine that. Wherever you go to work at, half of your staff, half of the company where you go to work at tested positive for COVID. What's happening with the other half of the staff? Are you in a rush to go back to work? What do you think is going to happen to you? What are you bringing back to your families? These are concerns for these workers. Now, OSHA is supposed to be taking care of things, okay? Occupational Safety Administration, okay? However, the federal agency in charge of worker safety has not issued any enforceable guidelines for protecting the employees, okay, from the coronavirus, as it did during the H1N1 outbreak in 2009. Instead, they're opting for voluntary guidance. The agency said that it plans no enforcement action so as not to overly burden the companies during the pandemic. Well, this is just part of the same routine that's been going on right now. Okay. There is no leadership at the federal level. Okay. Right now, we're the only Western country that doesn't have a federal organized national response to the coronavirus. The president just dropped this right on the states, on the governors, and then complains when he doesn't see the results he'd like to see. But that's what's happening right now. Now, on April 16th, the JBS plant in Greenlee was forced to shut down after roughly 100 workers contracted the virus, and 3 of them actually died. Okay. Another worker died during the closure, and 4 others since the facility reopened in April. Okay, the cases now exceed 300 in the Colorado Department of Public Health. Okay, environment records show that. Okay, the cases continue to rise, and the local unions are obviously not happy about it because they're there to protect their own people, and the people are scared to go to work because they keep getting sick. Okay, there are hundreds of workers who just have not come back. We don't know where they moved on to, or if they're on ventilators. We just can't find them. That's what the union president said. Now, Nikki Richardson, a JBS spokeswoman, said that in an email, the company has adopted more than $100 million worth of enhanced safety measures throughout its facilities, including increased sanitation and disinfectant efforts. Okay. Health screening and temperature checking of team members and training, physical distancing, trying to reduce the speeds and increase the availability of personal protective equipment, okay, including face masks and face shields. However, okay, just that the improvements have made, on the processing side of things. Additional measures still need to be taken. They understand that to lessen the risk of infections. Employees are still crowded in the hallways and stairways because of the loud noises in the plant. The workers often take off their masks, okay, and lean in close to communicate with their supervisors, okay. And they said they're doing the best they can to ensure social distancing in the facility, but we recognize the challenges that exist to try and maintain social distancing in areas where people naturally congregate. Okay, in an email, we've hired people as part of an employee health team that are responsible for COVID-19 program management and compliance and auditing, including enforcing social distancing. So they're doing what they can, but it's not happy for the employees. It's not happy for the employers. Okay, but lo and behold, we're still getting our burgers and chicken parts. Now, Friday. On Friday anyway, an outside independent study showed that 96,000 patients worldwide, this was published in one of the oldest, most reputable medical journals there is, The Lancet, can actually give you, okay, a 400% increase cardiac risk by using the miracle drug, which isn't a miracle drug. Okay, the president's been touting it for years now, and for months. Okay, said he was actually taking it. Okay, but we sort of doubt that he has been. But the study came out Friday that showed an increased chance, 400% increased chance of life-threatening arrhythmias. Now, we're coming off of the weekend, okay, Memorial Day weekend, and it's been a mixed bag depending on where you live and what you personally believe. Now, a lot of people were out and about, almost like nothing ever happened at all. Okay, most people that I saw, I live right outside of Philadelphia, were wearing masks. Okay, and I'm sure you saw others in the news. There's tons of coverage of large groups of people in varying states, okay, not wearing masks. Some out in the Ozarks around the lake there, some out in the beaches in Wildwood, okay, beaches other places, down in Miami, Dade County. Okay, now there was a recent Facebook post that I saw that said Japan only had 830 deaths, okay, and no lockdown. And that seems to be true. Now, someone that lived there for 14 years said that as a society, they routinely wear masks. They think that if there's any chance that they might be ill, they're going to wear a mask. And again, the Oriental cultures, by their nature, are more reserved and more polite than what we are here in the States. Now, the other thing they have going for them is that they have an exceptional contact tracing. So they all wear masks and they have had exceptional contact tracing. They didn't have any lockdown at all, and they only had 830 deaths. The actual post said 850, but in reality, it was only 830 deaths so far, according to Johns Hopkins. And that's where I'm going to take the numbers from. So if you want that type of result, you need to do what they do. However, Americans are too busy kicking up conspiracy theories and pushing all the false information about people passing out wearing masks. It really doesn't seem to be the case when an entire surgical team spends 5 hours plus wearing masks doing open heart surgery. Now, I know because I was a registered respiratory therapist, and as a student, I stood in an operating room next to a nurse anesthetist for 5+ hours, and I watched the surgery. I was wearing a mask. Everybody was wearing a mask. Nobody passed out. What a surprise. Now, the purpose of the mask is the same then as it is today, to protect someone else from us, not the other way around. Would you ever go into surgery? Think about going into surgery, having your wife, your husband, your child go into surgery if nobody in the room was wearing a mask. They're breathing all their stuff inside your loved one's insides as they got them cut open. The risk for infections are off the wall. What a surprise. Now, if you have that very, very basic understanding, it really should eliminate all the controversy about wearing masks. But I'm just sure it won't. We're a very strange nation. Everybody thinks their individual rights are supersede everybody else's rights. Anyway, it's a discussion for another day. The Dow right now is basically sitting around 25,000. Okay, and it seemed to be settled in at that level as a base. I wasn't certain where it was going to go, but it seemed to be settling in around the 25,000 range right now. Again, it goes up 500, down 1,000, whatever. It's in that range, and it seems to be a base at this point in time. I don't expect to drop out to 10,000 anytime soon. That's not going to happen. It's also not going to go up to 30,000 either. Okay, but at 25, 28, and it should stay in that range for a little while. Now, last week I was going to make an announcement on Thursday, or actually last Monday, but things happened that were totally outside of my control, and I had to postpone it. Well, everything is back on track, and so today I wanted to let you know I'm really excited. I've been featured again as a featured author in a new book, Focus on Systems, Using Systems to Operate Your Business with Ease. And it's available today. It's on Amazon for just 99 cents. Now, I really can't wait to hear what you think. So grab your copy and write a quick review on Amazon, or just forward me your thoughts in an email or a message on Facebook. I'll post a link at the bottom of this live. It should be posted there now, actually. Now, professionals from around the country, including me, have been featured in this must-have book. Okay, Focus on Systems is specifically written for entrepreneurs and people that want to be entrepreneurs. This book will give you insights into what could be your plan B, because some people still want to actually retire. Now, they used to be uncertain as to whether they have enough money to do that or not. Well, after the last 3 months, the uncertainty is absolutely gone. Right now, they're 100% certain they won't have enough money to retire. So if you'd like to put your retirement plans back on track, okay, have the cash flow you want and need to retire in the lifestyle you want and deserve, okay, sometime within the next 3 to 5 years, go to drrousenow.com and see if I can help. Okay, take a peek. There's a video there that explains what's going on, and I'll see if I can help. We can schedule a chat and we can talk and see if it's going to work out for you or not. Now, I'm Dr. Fred Rouse, the Real Money Doctor. My only goal is to help you get, protect, and enjoy your money, your life, and your retirement. Now, I appreciate spending some time with you tonight. Okay, I look forward to spending some time with you again tomorrow, around 7 o'clock, hopefully. So, email me your thoughts. Go take a peek at the book. Pick up a copy of the book. Get a Kindle book, 99 cents. You'll be amused at an absolute minimum. And again, it's a small book, quick read, probably less than an hour or two. And I look forward to seeing you tomorrow around 7 o'clock. Thank you.